Today, we requested the county CEC's caucus, that is the top leadership of the CEC of health within the 47 counties. We had an early engagement with them, the entire CEC in Mombasa, where we took them through the shift from National Health Insurance Fund, that's NHIF, to the Social Health Insurance Fund. We've also worked with them very closely during the rollout from the 1st of October, and therefore we felt that it was important that we have an engagement with the CEC caucus to review the performance and the challenges that the system is facing, the challenges that we are facing in terms of implementation of the Social Health Authority. Indeed, it has been a very successful discussion. We've received a lot of feedback, and from this feedback, we are going to now come up with an action plan where between the national government, Social Health Authority, and the counties, we are going to form a team that will be able to spearhead this rollout across the 47 counties. So every county will have a team, a multi-sectoral team that will be able to support the rollout. We've agreed that this multi-sectoral team will also include other government agencies like the National Government Administration Service or officers, whom will also play a key role. You are aware that we also, as a ministry and the Social Health Authority, we called all the deputy county commissioners at the KSG, where we took them through, and under the leadership of the regional commissioners, they now took up the responsibility of going to support the rollout. Counties have also accepted that we adopt the same structure, and now we bring all the agencies together. That's a very key outcome of this workshop today. The assurance I'm giving the public is basically one, that once the system stabilizes, they will receive their services without any interruption. Two, I also want to assure the public that they are going to get more benefits as opposed to what they are getting under the National Health Insurance Fund. The most important thing is every citizen who has registered can access free medical cover at level 2 and level 3. So our nation is going to have a healthy population because they will be able to access the healthcare. And as we go along, as we contribute as a nation, the huge disease burden that we are facing is going to be a thing of the past because the government has taken care of the chronic and critical illness funds to support those who are in need of support in terms of critical care. But the most important thing also that needs to be understood by the public is that for the first time since our Constitution 2010, that we are going to provide for emergency care as provided for in Article 43 of our Constitution, subsection 2, that every citizen is entitled to emergency care. I want to assure the nation that as long as we continue contributing to our Social Health Insurance Fund, we are going to offer quality care and also affordable care to the citizens. The NHIF Act could not accommodate the rollout of universal health care, and therefore we passed the 4 laws that will support, which was the legal framework that will support the rollout of the universal health care coverage. And therefore, we had to come up with a clear roadmap of now moving from the NHIF to the Social Health Authority. The key thing also that we looked at is we have now 3 funds as opposed to the earlier NHIF where there was only 1 fund, which was the contributory fund. But now, under Social Health Authority, we have 3 funds. That's the Primary Healthcare Fund, which will cater for treatment of patients at level 2 and level 3 facilities. And this will be provided free to those who are registered under SHA. And then the second fund is the Social Health Insurance Fund, which is a contributory fund for all Kenyans who have registered and have either they are salaried or they are unemployed. If they are unemployed, then they have to be verified through what's called the means testing or assessment of their income based on their status, and they will be the assessment will be done, and they will know exactly how much they're supposed to pay in terms of their contributions, which will be 2.75%. Those who are salaried will definitely, from this month, the employers are going to deduct their 2.75% from their gross salary to be paid to SHA on the 9th of November. So the shift is basically because we have three funds. I have talked about the two funds. The other fund is the Emergency, Chronic and Critical Illness Fund, which will be funded through the Exchequer. So you realize that under this new funding model, we have two funds that are catered for by the national government. That is the Primary Healthcare Fund and the Emergency, Chronic and Critical Illness Fund that is appropriated and budgeted for through the National Assembly. But the middle fund, which is Social Health Insurance Fund, is what is member contribution. So there is definitely need to shift from the NHIF to the Social Health Authority. Our enrollment has been quite successful. We have enrolled 12,800,000 members, 8 million being, most of them being members of the previous NHIF, and then about 4.5 million being members that were newly registered. As we are approaching the first, we saw a lot of people registering. The number went up. There was a lot of push for registration, you remember. And right now, the registration is stagnating. It's not moving up the way we expected. So what we have agreed is that as a result of this meeting, we are also going to work with the counties to increase the enrollment. We also realize that as people are registering, some of them at that particular time are not adding their dependents. So we have agreed here today that together with the counties, now we are going to do sensitization where we have the members who have registered and they have not added their dependents. So we are going to come up with a manual that will be given to the CHPs, it will be given to hospital staff that are working there when a patient comes and they realize that they have not onboarded their members, their staff, their dependents, they can quickly do that. But the key thing is to do early sensitization so that most of them onboard their dependents. So we have agreed on a strategy of how to do that, which will commence next week. The national government requested NHIF to provide enhanced medical cover for the civil servants. And similarly, the county governments also requested NHIF to provide enhanced cover for their employees. Under the social health insurance, now there is no enhanced cover anymore. We are all entitled to one cover, one benefit, one tariff for all the services. And that's why the county governments now, as an employer, have to look for an alternative private insurance to provide for the enhanced cover that they were giving to their employees. Similarly, the national government is also in the same process. The challenge that they have been facing is that the period that the notice that we gave them was too short a notice, and they requested for extension. We have since then extended for the national civil servants up to the 21st of November, when NHIF will cease providing any service. So currently, they'll get the enhanced service, but we expect that by the 21st of November, there will be a solution that the national government and the county governments will have gotten. Some of the county governments have already engaged some of the private insurance firms to cover for their employees. It does not mean that now they have been told to go and look for cover elsewhere. They are entitled to their social health insurance funds, and we expect that when they go to the facilities, they will present themselves and they will be treated. If there is anything extra over and above what is not covered under SHA, then they can use their private insurance, which is provided for by the employer, that's the county government.